Good evening, sir.
Good evening, Chakradhar.
Sir, what is the constitutional prescription and acute prescription?
Yes, this is a good question. Often this question is often asked by many youngsters, especially postgraduate graduates. We have basically two types of prescription. One is acute prescription and constitutional prescription. Acute prescription means where this kind of prescription is applied to the acute diseases, where all the symptoms occur suddenly. The sudden onset, the pace of the symptoms is fast. All complaints, all deviations are since few days, 1 day, 2 days, or 3 days. So generally we think of the remedies like short acting, quick acting remedies for acute prescription. The constitutional prescription or chronic prescription is used for especially for chronic diseases where patients are suffering from many months to years. Then we go for deep acting remedies. Then we call it as a constitutional prescription or chronic prescription. But there is no hard and fast rule. Sometimes the remedies what we say like belladonna, bryonia, we call it as acute remedies. Sometimes if the totality of symptoms match very well in chronic diseases, they also can act like constitutional remedy. Remedies like arsenicum album, lycopodium, sulfur, which are deep acting remedies, if the acute totality demands, then we can prescribe these drugs as acute remedies. Okay, there is no hard and fast rules, but majority of the time acute cases requires short acting, quick acting remedies. Chronic diseases, deep acting remedies. And we have many cases where there is acute episodes, still they require constitutional remedy. Getting my point?
Yes, sir.
Because same the constitutional pattern is heightened during acutes. There is no new pattern. What Hahnemann tells, treating acute diseases is easy because the deviation from the formerly healthy condition has occurred recently. All the symptoms of sickness are in the patient's fresh memory. All symptoms are on the surface. Even the peculiar symptoms are on the surface in acute diseases. In chronic diseases, since patient is suffering from many months, years, patient may not remember every symptom in detail. While treating in chronic diseases, the physician should ask many questions regarding different areas. Making totality for chronic disease is difficult. Making totality for acute disease is easy. So treating acutes is easy. Treating chronic diseases are little difficult. So what is acute prescription, chronic prescription, how to make totality for acute prescription, chronic prescription, in which acute diseases same constitutional remedy holds good. All these points we will talk tomorrow.
Okay, sir.
Right?
Thank you, sir.
Okay, bye.